Very good afternoon to us all, and welcome all the participants to our webinar today with the theme Health Insurance and Facilities for Immigrants. And I would like to greet those who have spent time to attend this webinar in person. Good afternoon, and also our colleagues, friends who are joining this webinar virtually, wherever you are. So good afternoon and welcome to our webinar. Today is our very lucky day because this is the first time we have this webinar in this, newly decorated building. This is Indonesian Cultural Center. We have a lot of batik displays and traditional costumes and also Indonesian handicraft here. So we are very lucky today. And also today we are also very lucky because we have these two beautiful ladies together with us and one handsome gentleman over there. Oh yeah, thank you very much. To share some information about the insurance, health insurance for immigrants. Let me introduce myself. My name is Made Sintarajaya. I'm the Consul for Protocol and Consular Affairs at the Indonesian Consulate General here in Chicago. I'll be moderating our webinars today. And with me, as I said, I have two beautiful ladies accompanying me. First is Ms. Clarita Santos. She is Executive Director, Corporate and Civic Partnership, Office of the President and CEO, Healthcare Service Corporation. The other one is Ms. Joyce Ann Valdez. So if I pronounce your name correctly, she's Senior Field Advocate, Government Business Solution, BlueCross BlueShield Illinois. And again, no other than our friends, our dear friends, Mr. Martino Tangkar, the President of Indonesian Diaspora Network in the US. So we brings the topic of health insurance because this is actually a very important topic. The health care cost here in the US is very expensive. If you're not, you have to pay everything by your own pocket. So I think the information about health insurance, especially for those who are working in the informal sectors, will be very important. So again, thank you very much and welcome here, Clarita and Joyce. We appreciate your willingness to share the information with us. Yeah, and before we go to the presentation, I would like to play remarks from our Consul General. He is because he has already had an appointment, another appointment today. He apologized he could not join with us in person this afternoon, but he sent his remarks, which is pre-recorded before. So we would like us together to listen to the remarks given by our Consul General. Please.
Good afternoon, Ms. Clarita Santos, Executive Director, Corporate and Civic Partnership, Office of the President and CEO, Healthcare Service Corporation. Ms. Joyce Ann Valdez, Senior Field Advocate, Government Business Solution, BlueCross BlueShield of Illinois. Mr. Martino Tangkar, National President, Indonesian Diaspora Network-USA. ladies and gentlemen. First of all, I would like to convey my highest appreciation to our distinguished resource persons, Ms. Clarita Santos and Ms. Joyce Valdes, for their willingness to participate in this webinar and to disseminate information about health insurance and facilities for Indonesian citizens and workers. My appreciation also goes to Mr. Martino Tangkar for his cooperation and support to make this webinar possible. Ladies and gentlemen, one of the main duties of the Indonesian Consulate General abroad is to serve and protect Indonesian citizens. It is in fact that significant numbers of Indonesian citizens who live in the greater Chicago and the Midwest area are working at informal sectors like restaurants, food trucks, and food production, as well as public sector like transportation. Looking at the nature of their works, those conditions have made insurance for personal health is needed, particularly in the pandemic era. Therefore, in the way to improve the protection to all the Indonesian citizens abroad, it is necessary for Indonesian Consulate in Chicago to remind all Indonesian citizens about the importance of having valid and good or fully covered insurance for their personal health. I have the pleasure to share with you that during the last 2 years, the Indonesian Consulate General in Chicago have been helping the Indonesian citizens in Midwest, those affected by the pandemic, by sending them care packages consist of medicines, vitamins, and foods. We are happy that this afternoon we have 2 experts on insurance sector that can share with you some information about health insurance and facilities for foreigners, in particular Indonesian citizens. I encourage all the participants to make use of this webinar to explore as many as information from our resource person. And I wish that the information gathered from this webinar will be very useful for those Indonesian citizens who really needs it. Thank you and have a good webinar.
Thank you very much, our Consul General, Mr. Mary Binsar Simorangkir, for his very kind remarks in our webinar this afternoon. Next, I would like to, before we go to presentation, I would like to invite our colleague, Mr. Martino Tangkar, the President of the Indonesian Diaspora Network-USA, to give his welcoming remarks. Please, Pak.
Terima kasih Pak Madi. Good afternoon, everyone. We are glad to have all of you in this informative webinar. This webinar will be a useful learning and training tools for everyone. I'm sorry. Healthcare insurance topics has been a hot topic lately, especially during this long COVID pandemic. The purpose of this webinar is very simple. We want to help and educate people so they are more well informed from the first hand. We are delighted to have some key people as our speakers who are very resourceful. Thanks so much for making this happen. So we can learn from the experts and to know about the basic knowledge of healthcare insurance and how the system works. My role is to bridge, as we all know that we have relationship between government to government, G2G, and community government to community, G2C, and community to community, C2C. I just fill the gap and representing the community. This virtual webinar will benefit everyone, not only Indonesian community, but also community at large who watch this streaming right now. Some audience probably not reside in the state of Illinois. However, the general framework can be implemented with some adjustment on your local conditions. Special thanks to Ms. Clarita Santos, the Executive Director, Corporate and Civic Partnership of Office of the President and CEO, Healthcare Service Corporation, Ms. Joyce Anvaldes, Senior Field Advocate, Government Business Solution, BlueCross and BlueShield of Illinois. Healthcare Service Corporation is a mutual legal reserve company, or HCSC, and the parent company of the BlueCross and BlueShield Association, BlueCross and BlueShield of Illinois. Is the largest customer-owned health insurer in the United States and the fourth for overall. That's according to Google. I don't know if that's right or not. Yeah, but since both of you are here, I just want to compliment I know Miss Clarita Santos for over than 10 years, but this is the first time that she is willing to share with us. And also, she is working for a very big company, as she is she work on with the in the office of the CEO, office of the president. If we count how many members is with the Cross and Blue Shield of Illinois, she works for the president. She's just like a minister. So so many of the Indonesian Consulate General staff here also member of the Blue Cross and Blue Shield, and actually they are also your member too. It's just like a big nation, big country. We also want to acknowledge that this webinar is also a partnership between Indonesian Consulate General in Chicago and Indonesian Diaspora Network-USA, with tremendous support by our own Consul General, Mr. Mary Binsar Simorangkir, and also Mr. Made Priyadi Sentanajaya, Consul for Protocol and Consular Affairs of the Indonesian Consulate in Chicago, who also will be the moderator of this webinar. Thank you so much. Last but not least, we also would like to acknowledge our sincere gratitude to all audience, volunteers, and consulate staffs. Without them, this webinar won't be meaningful and fruitful. Much appreciated and enjoy this webinar. Thank you.
Thank you, Mr. Martin Tankar, for your very kind remarks. Next, of course, we'll come to our presentation session. I should inform you that because we have the two resource persons, so each will have like 50 minutes roughly, but of course you can utilize more time to present your presentation. But first we will have Clarita to give her presentation. But before you start your presentation, let me introduce you. Clarita Santos is Executive Director of Corporate and Civic Partnership for Healthcare Service Corporation, the nation's largest customer-owned health insurer, operating through its Blue Cross and Blue Shield plans in Illinois. In Illinois and Montana, New Mexico, Oklahoma, and Texas. Right, and she's working for the Office of the President and CEO. She's responsible for strategic planning and execution of key initiatives focused on access to care and economic opportunity. Santos joined in HCSC in 2007 and has held several positions responsible for community relation and corporate social responsibility initiatives. Previously, she was Executive Director of Community Health Initiative at BlueCross and BlueShield of Illinois, where she oversaw community engagement through grant funding, volunteerism and outreach, and working with community stakeholders to help increase access to care and decrease health disparities. She considers the Blue Door Neighborhood Center a hub for health and wellness in Chicago's Pullman, Morgan Park, and South Lawndale as one of her major collaborative accomplishments. Santos is founding board member of the Center for Asian Health Equity at the University of Chicago Medicine and is currently chair of the Executive Advisory Board of the University of Illinois at Chicago School of Public Health. She's also a board member of the Illinois Coalition for Immigrant and Refugee Rights, Chicago Sinfonietta, and the Common Ground Foundation. Her work has been recognized among the top 100 under 50 emerging and executive leaders from Diversity MBA magazine and the Illinois Department of Public Health Champion of Change. Santos holds a master's degree in public health from the University of Illinois at Chicago and a bachelor's degree in biology from the College of Charleston. She and her husband Steve are the proud parents of 2 Chicago Public School high school students. Same with me. Yeah, so okay, Clarita, you can start your presentation.
Great, thank you so much. I'd like to thank the Indonesian Consul General's Office and Martino for inviting both Joyce and I here to present. It's really an honor to be here and share information with you all. And Martino, I like your C2C, community to community. And that's also what we believe in at BlueCross BlueShield of Illinois, that what's good for the community, it's good for all of us because we're all part of the community. So I wanted to start out, I'm first generation Filipino American. My parents came here in the 1960s. My dad joined the Navy in the Philippines, and that's how we got here. And so I was born in California. My sister was born in Texas because that's where my parents were stationed. And one of the things that I've worked on is because of, it's around access to care. So how do people get access to healthcare, right? And so I devoted over 20 years thinking about how do communities get access to care. So what I wanted to do is just get a general overview on how do you get medical care in the United States. And then Joyce will go into the details around insurance and how that works. So just in broad strokes, and I'm going to be focusing more on Illinois, since we're in Illinois, so if you're in other parts of the state, this is just generality, so please refer to your local health departments for specific information, but in general, just wanted to give an overview how healthcare works in the United States. So I'm gonna start off with the first question. So what do you do when you're sick? Where do you go for healthcare? I wanted to start off first by going to those agencies that are funded by the government. So those are called clinics, and those clinics are called federally qualified health centers. So the federal part means it's funded by the government. And so these are clinics that are usually located in neighborhoods or where you live. And what they do is they provide healthcare. So there's doctors there, there's nurses there. They provide healthcare around, like if you have a cold, right? If you need to get a flu shot, if you need to get vaccinations, if you hurt something, your first point of access to get care is through these clinics. So examples of that include Asian Human Services. They have a federally qualified health clinic, Access, as well as Erie Health System. So now the question is, so how do you pay for that, right? So yes, there's clinics, but then how do you pay for the care of these organizations that are government funded? There's something called a sliding scale, and what that means is it's just a fancy word of saying you pay according to how much you make. So if you make more, you pay more. If you make less, you pay less. So that's really around the federally qualified health clinics or the federally funded or government funded clinics. So that's one way of getting care. The other care, and I'm going to talk about it from what do most people use? The second way is through private. So what that means is, so for example, my friend Christine went to medical school and she became a doctor. she became a pediatrician. So what had happened is, after she became a pediatrician, she and other pediatricians came together and created their own practice. So the other way, that's considered a private practice, right? Where individual doctors come together and create a practice to provide services. And so that's considered, private medical care. And usually the way private medical care works is you either, pay for it from your out of pocket or through your insurance. And that's what Joyce will be covering today. So through insurance, you can pay for that care. You can also do that with the government-funded health clinics. The second way you can get care is through the hospitals, right? I'm sure have you all heard of Cook County? Who's heard of Cook County Hospital or Stroger Hospital? I'm sorry, I'm dating myself, right? Stroger Hospital, that is a government-funded hospital. So that means, based on what you make. So it's also a sliding scale. So the more you make, the more you pay, the less you make, the less you pay. And so for hospitals, you go there for surgery, the really severe type of healthcare, right? When you get you need to get a surgery for your heart, right? Or if you need something, your leg needs to have like a tumor or any type of really major medical is where you go to hospitals. Now, hospitals also have an outpatient part, which means you can also get care that's not that serious. But mainly, the two ways that you can get healthcare in the United States is through the clinics that are government funded or private funded, or through the hospitals, which are the government funded or private funded. There's a third way that is also part of the clinics, and that they're called free clinics. So those are clinics that are usually organized by individuals, and it's free by its name. So you go there, you're able to get care. That some of them are free, some of them is also sliding scale, right? Meaning the more you pay, the more you make, the more you pay, the less you make, the less you pay. So those are the kind of different ways in which you can get your care addressed. Any questions on that? Or that's later. That's later, yes. Great, thank you.
Okay, thank you, Clarita, for your very concise yet very informative presentation. Of course, we will take all the questions after the presentation, yeah? That's all right. So we'll take, so please, if you have any questions, anybody in the room or those who are participating in this webinar through Zoom meeting, have it ready at the question and answer session, which will be start soon after the second presentation. You can write down the question in the chat room, or for the participant in the room, you can just raise your hand. You can ask your question, whatever languages are you able to express yourself, whether in Indonesian language or in English, Bahasa Jawa or Sunda or whatever. We can just try to translate it for you and deliver it to our resource persons here. Okay, I believe there will be a lot of interesting things that we can, explore from the information given by our dear Clarita here. But please prepare it and be ready on the question and answer session. Okay, thank you, Clarita. So we'll move to our next presenter, our next resource persons. Before she starts her presentation, I would like just to introduce to you Joyce Ann Valdez, Community Relations Specialist. Joyce worked for several Chicago area hospitals for 27 years as a medical assistant, Latino Committee Events Coordinator, and as a trained Spanish medical interpreter before joining Blue Cross and Blue Shield of Illinois in 2013. She also worked with State Farm Insurance as an office associate. She has coordinated health fairs, physician lectures, and has organized health screening sessions to educate her community. Joyce holds a bachelor degree in organizational management from Concordia University in River Forest and has a certificate for interpreting in the medical, educational, and legal settings. She looks forward to continuing her education and plans to pursue her master's degree. Joyce is an active member of the Latinos for Advancements, a business resource group at BlueCross and BlueShield of Illinois. Joyce is also an avid scrapbooker. She loves to cook. I like to eat. That's me. Entertain, and when she finds time, may even put together a quilt or two. So, Joyce, the screen is yours, so you can start your presentation.
Thank you so much. Okay, so Clarita was speaking about how we can get care. So I'm going to talk about how we can get insurance and the different ways that you can get insurance. One of the ways is group insurance. Group meaning the insurance that you would get through your workplace. Then there's individual and family plans, and those you can get on your own on the marketplace, which we're going to talk about. You can get that directly through any insurance company, calling them, or you can do it online and purchase it yourself. There's also the government plans that you can get, like the Medicaid or the Medicare. So let's talk about the marketplace. As you see the screen here, my name is Joyce Valdez, and I'm the Senior Field Advocate for Blue Cross and Blue Shield. I have been with the company for almost 10 years. It'll be 10 years in March, and have worked with the Affordable Care Act marketplace plans and now the over 65 Medicare plans. Next slide. So this structure that you see here is how you purchase on the marketplace, what it's all about. So I'm going to go step by step so that you understand how the marketplace works. The first box says it helps you learn if you qualify for tax credits or cost sharing assistance. So what that means is it helps you find out if you can get money that the government gives you to help you pay for your insurance. Okay? It'll determine if you can get public programs and assistance. So what it does, the marketplace is like a mall, like you're going shopping for all different insurances. And when you put in your application, it'll ping off, it'll jump off of different departments, your IRS, your Department of Human Services, to see if you can get Medicaid, or to find out how much money the government will give you if you can get that. It'll present the plans after it tells you how much you're getting, and it'll show you all the costs of the plans. There you could start looking at the different types of plans, and I'm going to get into how you choose the different types of plans. What are you looking for? It will allow you to view and compare all the plans on the marketplace, and so that you can see which ones are best for you. And then once you decide, you go in, finish your application, and choose the plan that you want. And you can purchase it, and you'll get your card in the mail within that 2 weeks. Okay, next slide. So this chart is about the federal poverty level. The federal poverty level actually goes from 100 to 400. The reason that I have this chart from 100 to 250 is because anyone who falls in this table under 250 can qualify for additional cost sharing reductions. What does that mean? That means you can get lower copays, lower deductibles, lower out-of-pocket maximums. And I'm going to explain what those are. So when you look at the yellow column, and it says that you're eligible for 94% silver plan variants. It just means that you would be getting assistance up to 94% of help. And then on the lighter yellow one, it's 87%, and the 250 up to the 250 is 73%. So what that means is as you make more money, you get less from the government. Okay? And you could see if you're one person, what you could make starting is 13,590, all the way to at the end 33,975. In that range, you can still be eligible for those, or you can still get tax credits. Okay, if there's two in the household, then it's a little higher of income. When you look at under 100%, that's where you're looking at being able to get the government assistance, like a Medicaid card. And you would have to apply for that through the government, through like a Department of Human and Health Services, or going to a Medicaid office to apply. Next slide. So here we have the metallic plans. When you go into the marketplace, you're going to see the plans are going to be labeled bronze, silver, or gold plans. Just like jewelry, when you look at jewelry and you know bronze is cheaper than silver and gold is the most expensive, it's the same in terms of the insurances on the marketplace. If you look at the bottom where it says plan pays 60% and 40, or you pay 40, what that actually means is the value of the plan. Bronze is going to pay less for you. The silver is going to pay a little more, and gold is going to pay a little more. When you actually go in to look at the plans, it's not all going to be 60-40. Some of them are going to be 50-50. Some of them are going to be 70-30. It just depends on the plans that you think are best for you. But the bottom means this is the value of the plan. Next slide. So this is an example. I'm going to show you an example of how a deductible, a coinsurance, and out-of-pocket limit works. I'm trying. Okay, so in this example, this is Jane's health insurance plan. So Jane, in this example, has a plan, and she has a deductible for $1,500. What that means is when you incur a bill, the first $1,500 you have to pay. So in this example, the first office visit costs $125. So Jane would pay that entire $125, and the plan pays zero until you reach $1,500. Once you reach $5,000, one click, please. Click one. After you've had incurred more costs, medication, hospital bills, doctor bills, now you've reached that $1,500. Here's where the plan begins to share that cost. That's what that coinsurance amount is, that 30%. The plan is going to start sharing. They're going to pay 70% and you're going to pay 30%. That's the cost sharing factor. That's how they share the cost with you. And in this example, the visit is $100. Jane now pays $20 and the plan pays $30. I'm sorry, I changed it. $30 and the plan pays $70. So one click, more costs with medicines, hospital, and doctor. Now Jane has reached that $5,000 out-of-pocket maximum. So the last office visit costs $200. Jane will pay, the plan will now pay the whole entire bill, and Jane pays $0 for the rest of the calendar year. So once you reach that out-of-pocket limit, the plan pays 100%. So when you're thinking about it, if you go to, let's say, the emergency room and you have, Lord forbid, a gallbladder attack and you have to have it removed, and the total bill is $20,000. The most you're going to pay is $5,000 because that's your out-of-pocket maximum. So that's a very important number to check when you're comparing those plans. Which ones have the lesser out-of-pocket limits, the co-insurances, and deductibles. If you see it says 50%, that means you're going to pay half, the insurance is going to pay half. If you see 70-30, 70-30, or 40-60.
And then, kind of an inside scoop. I mean, this is what we do when we're looking at plans. We always look at the out-of-pocket limit because no matter what the bill is, the maximum you're going to pay is $5,000. So that's really a key thing to look for is the out-of-pocket limit and also looking at the deductibles. So those two things. So even if your thing costs $1 million, the maximum you will, because out-of-pocket, right? What comes out of your pocket is $5,000. So that's an important thing to remember.
And this is just an example. Most of the marketplace out-of-pocket limits are about $9,100. Yeah, so you're going to be looking at that when you're also seeing what the government is giving you. Next slide. Can you go back one? Again, keep going. There. Okay. So remember we were talking about the federal poverty level. If you're under 250 or less, you will see if your plans come up, the first plans that come up is the silver plan. That means that you have also qualified for additional cost-sharing factors, lower copays, lower deductibles, lower out-of-pocket. You're only going to see those in the silver plan. So when you do your application and all the plans come up, if the first thing that comes up is silver plans, those are the ones you're going to be wanting to look at. Sometimes you're going to see deductibles at $500. Out-of-pocket limit could be $2,000. That means that your income brought it to that amount, so you can get a lower cost of cost sharing. Okay, that's really important because sometimes people look at the bronze plan and may be cheaper, but you have to pay the first $9,100 first. So the other way, if you only have a $2,000 out-of-pocket limit, you're paying less out of your pocket overall. So you must look at that silver plan to make sure that if you're getting that cost sharing, additional cost sharing. Okay. Okay. Now we can go back to the marketplace pages. So now we're going to look at, these are slides that I put together to show you what it looks like when you go into the marketplace to start your application. So you see the green buttons there. It says, take the first step to apply. So you can click on that and go in and start applying. Next slide. And this one, once you've done your application, it says provide health plans and prices based on your income. So they're going to ask you how much do you make for the year, and it's a household income, and it's also so that means if you and a spouse work, you have to combine that and you have to file your taxes together in order to do this. It's a household income. You can't do one income and not the other. Next slide. So you could see, according to your zip code, is one of the ways that they look at what you're eligible for. You would put in your zip code. And right now, the marketplace that we are working on is Illinois. I don't know how many states are watching us right now, but you're going to go to your state and make sure that you're doing the plans for your state. Okay, let's see. There we go. We lost it again. Next slide. Yes. Okay. So on this one, tell us about you and your household. It's going to ask you a lot of questions. It'll ask you your name, your address, your social, and it continues to, you have to continue to press that green button to go to the next stage. It saves it up to that point. And you just have to answer all the questions correctly. It'll find out because the IRS is involved in all of that. They do evaluate all of it once you hit the end button. Next slide. So it asks how many in the household. You would click the circle that's corresponding and click continue. Next slide. Here, if you're married, you will file and return at the end of the year, the return at the end of the year. Like I said, only, what does this say? End of the year, married, you would select yes if you're married. So it's pretty simple. The instructions are pretty simple to get through it. Next slide. You will claim any dependent on your federal tax return, any children. Next slide. Tell us about you. It does ask you specific questions, and it's kind of weird because you'll put in information and they'll ask you, did you live at this household? Did you, and they ask you stuff that you like, how do they know? They know. So a lot of information that you have that you would need to put in. Make sure you don't miss a box and you fill it all up. Next slide. Confirm your household members, so you can add dependents, you can add your spouse, and they'll have separate questions for each person. Next slide. And then they're going to be looking at what you think your household income, this says 21, but it's actually what you think your household income will be in 2023. So if you know that you're not going to be working after the first month of the year, you're going to say zero income or whatever you make that month. If you know that you're going to work the whole year and maybe it's seasonal work, you have to calculate what you think your total amount is. If you calculate too much, at the end of the year when you do your taxes, the government's going to say, we gave you too much, you need to give us money back. If you say too little, the government will give you money back. So you want to make sure that you give them exactly what you're making so that you're not paying too much or too little. Also, if your income changes in the middle of the year, you need to let the marketplace know. If you make less, you may be eligible for Medicaid. If you make more, they'll change your plan. You may be not eligible for all those tax credits. If you don't do that, at the end of the year, the IRS is going to say, you were working more, so you owe us more money. So you always got to let them know. Next slide. Estimated savings overview. So at this point, it's going to show you, see how it says, what is that amount? $338 per month. It's saying how much of the tax credits you're going to get. So it'll let you know how much tax credits you're going to get for your plan. So now it says view plans. Next slide. And here's where, this is one example that's on the marketplace right now. It's the Blue Choice Preferred Silver PPO 203. Click once. This is an example for an individual who's 44 years old, household income of $55,000, and tax credits of with a tax credit of $23. So the government said this one person who makes $55,000 can get $23 from the government. So when you look at the plan, it already takes the $23 out, and the total is $643 with a deductible of $2,250 and the out-of-pocket max of $9,100. One click. This is an example of a family of 4, ages 44, 40, 16, and 10. They make $85,000. They're getting tax credits of $353, which makes their plan $922. Family deductible of $6,750 and $8,200 of a family out-of-pocket max. And the third click is an example of the same family that makes $40,000. So the tax credit now comes more. It's $790. With the plan now costs $485. It's cheaper because they make so little money for 4 people, and a family deductible of 0 and a family out of pocket maximum of $2,500. And the reason I did this example is to show you that everyone is different. There's no how much is the insurance anymore, and you could tell them like this. No, every person, depending on their situation, how many in the family, whether they smoke or not, your zip code, your income are all factors to decide how much tax credits you can get and how much your insurance will cost. Next slide. So great, you found a plan that you want, and this here, then you're going to go ahead and start to create your account and create your application, your account so you can choose. Next slide. You're going to put in your state that you're in. Next slide. And that should cover it. Then you create your account. You're going to have a password, a username. Make sure you keep that safe because that's the one you're going to use every year. And don't confuse them. Sometimes you may go into your insurance company and create a cart as well, and you'll confuse both of them. So make sure you keep them well stored. Next slide. So this is my team. We are a team of 5. We're called the Think Blue team, and we are not commission agents. We are salary agents from Blue Cross and Blue Shield. So what we do is educate a lot, and we do sell. If you need us to help you with that, we can do that. But I love the fact that we have the time to go ahead and explain and educate and help that person make that informed decision. Next slide. One more time. Yeah. So you're going to get this PowerPoint. This PowerPoint can be shared, and on the PowerPoint you have my information. That's my cell phone, my email address. You also have a link where it says click here for a virtual appointment. You click on that, it'll make an appointment directly for me. And then it says click here to see my personal events and seminars. Anywhere that I'm going to be, you'll be able to click there and find me. And then and that's for assistance for enrolling in the marketplace, enrollment for 18-year-old all the way to 64-year-old is November 1st to December 15th. If you're over 65, annual enrollment is going on as well, October 15th to December 7th.
So Joyce, Joyce, quick question. So now open enrollment means people can get insurance now until December 15th. And the people need help on the computer, they can call you and you can help how to do that?
Yeah. And you know what I just noticed? It says December 15th. It's actually January 15th. Yeah, I just noticed that. Sorry. Yeah, we have more time till January 15th for the under 65. Over 65, it's over December 7th. Next slide. Now, if you would like to reach out to one of our agents that are closer to you, as you see, I'm in the Chicago North and Northeast Cook County. Glen Brooks is in Chicago South, South Suburban Cook. Santana is in South Suburban and Northwest Suburban Cook. Jasmine is DuPage, Will, and Kendall counties. And Marta is McHenry, Kane, and Lake. If you want to have someone help you closer to you, any one of those, you click on that blue link and you'll be able to make an appointment directly with them. And then you see the little oval circle, the www.thinkblueil.com. There you can go in, you can read our bios in there. You can see our downloadable materials, and you can view learning videos that we have, and also find where we're at, our calendar of events. Next slide. Yep. And that concludes my presentation. I'm here for any questions when we open up the forum for questions and answers. and I'll be sticking around afterwards if you have any other questions as well. Thank you so much for having me.
Wow, thank you very much, Joyce. Okay, you can continue, please.
I have to mention this. Sorry, they weren't on the slide. That's why. I wanted to mention that the HMOs and the PPOs. What are the differences with HMO and PPO? HMOs are a more managed plan. So what that means is that doctors, there's a doctor, you have a primary care physician whom you go to and for everything. And that doctor will try to take care of you. And if you can't, then they will refer you to a doctor or specialist. But you should always go to your primary care physician first. Otherwise, without that referral, it won't pay for it won't pay for any services. Your PPO is more, you have more freedom in using the PPO. The HMO has a smaller network, so smaller amount of doctors and hospitals, and a PPO is a much broader network, more hospitals and more doctors. The difference between urgent care and emergency care. Urgent care is for services that aren't emergencies where they're life-threatening, and they're not as full. When you go to the emergency room, you'll find that a lot of them are full because a lot of people use it as a doctor office as well, and that's where those ERs, emergency rooms, get really backed up. So if you go to an urgent care, you're more likely to be seen faster. It's a lot cheaper, especially if you don't have any insurance. Then you want to make sure that you're not paying $2,000 just to go into the room, where an urgent care might be $60 or $80 just to go to the room there. So urgent care is your best bet if it's not a life-threatening situation. And then we have Medicare. Medicare is for over 65, and Medicare for people who have worked in the United States 10 years or more get what's called Medicare A, and there's Part B. A is for inpatient care, and B is for outpatient care. Between the two, they pay 80%. And if you can get Medicare A and B, then you would also be looking at another plan to help pay for the other 20%. And then you have your Medicare, Medicaid. Those are dual eligibles. Those are people who have Medicare and the government plan that covers the balance and helps out with other services like your Part B premium and things like that. So there's a lot of services that help out in picking up that balance that Medicare doesn't cover, because it doesn't cover everything. And then I wanted to talk about the undocumented and undocumented who don't have insurance. There's several things that I wanted to mention. We have the mixed families. So a person who is a citizen or a resident, and let's say the husband who works is the spouse who is not documented, the wife could still get insurance through his income if he keeps a ledger or a notebook of all the days he's worked and how much he's made. Okay? IRS will accept that as income for her. Okay? You can purchase without providing your immigrant status. So you can actually go on a marketplace, and you don't have to say that you're an immigrant, but you will not be able to get that help from the government because you're not documented, so you wouldn't be able to qualify. Okay. If you're at least 42 years old up to 64, this year Medicaid has provided services for medical that you can apply for with Medicaid. And if you're trying to get your status, your resident or citizenship, it will not affect that. You can apply for it, see if they'll give it to you. It's not always a sure thing, but you should always apply and see. And if you do get it, don't worry about your status; it will not affect it. Otherwise, anything outside of those age groups that I talked about, so below 42, you must be a citizen or a resident. You have to be a resident at least 5 years in order to apply for Medicaid. Okay. On the marketplace, you just have to be a resident or a citizen. It doesn't matter. You don't have to wait 5 years. You can purchase on the marketplace right away. So for I have for Medicaid, your household income, if you apply, must be below $18,754 for one person, or below $25,268 of a combined income for a household size of 2 people a year. Yes, that's for Medicaid. And if you're 65 or over, you may be eligible for the health benefits of immigrant seniors. And that's that Medicaid that they just opened up this year. So you can also apply for that. Now, there's another plan that we have for those who travel and are looking for insurance when you travel. We do have what's called Geo Blue. If you wanted to get insurance for traveling, Geo Blue will insure you just for that one trip if you're looking for something like that, or the whole year. They have different plans for you. And
So if people go to Indonesia, they can purchase Geo Blue.
Geo Blue, if you go to Indonesia, you can purchase the Geo Blue and have coverage. So if something happens out there, you're covered. Yes. Okay. It's not expensive. It's pretty reasonable, about $30-$40 or something like that. One trip. Yeah, it's not bad. You have to go on the website geoblue.com, and it'll tell you all the plans on there, what they cost and how much they cover. They cover pretty good. The one trip. Hmm. Yeah. And no, no. Well, they have to be no. It would be from here going to visit out there. They have to be living here in order to purchase the plan. They have to purchase in Indonesia, right? If there's if they're going to go back and they're residents over there, yes, they would purchase over there. Yeah. Okay, that would. Now I'm concluding it.
So thank you very much, Joyce, for this very, I think, very packed information. There are a lot of things, a lot of information that you have given us. Perhaps we need to digest it very intensely. Of course, now we'll come to the question and answer session. I believe that there are a lot of questions around here need to be asked to these two resource persons. But before we start, what's the name of the website? Healthcare.gov, yeah?
Healthcare.gov, yes. The name of the website is healthcare.gov in order to look at all the plans. You're not going to look at only Blue Cross. You're going to be looking at all the plans there and compare
I think
them.
that's very useful information. So please note this website if you would like to have information on what are the insurances available on the marketplace. And again, people, I can share you the presentation by Joyce, so don't worry about it. So you don't have to screenshot every. We will share the presentation. Don't worry about it again, because yes, there are a lot of information inside the presentation. Right. Okay. So for the question and answer, you can ask any questions. But first term, we will take 3 questions from the person who is already in here together with us. You can ask your question, you can put your question in Bahasa Indonesia or in English. Of course, we will help you to translate it if it is in Indonesia. Should I start with first question? Okay, the lady in Batik, please introduce yourself and to the point of your question.
Thank you very much. My name is Astri. And first of all, I would like to thank the Indonesian Consulate General Office for helping us with this kind of great information. It's been like a lot of things going on, and we've been like trying to get information about the healthcare facilities and everything, and this is the time. So I have one question from friends of mine who are undocumented. They are not here because they are busy, but they have question. What is the requirement and the paperwork that they need to provide, the qualification, in order to get the healthcare insurance for the undocumented? So will it be affected their status or anything, how safe it is, and everything we need to understand on how, whether we need the ID tax number or not, what happened if they don't have it yet.
Okay,
Thank you.
so it depends, first of all, if they're under 42 years old, then they will not be eligible, or they won't be able to get the tax credits. So they would just purchase outright on the marketplace and pay the full price if they wanted to do that. If they're over 42, from 42 to 64, they can apply at a Department of Health and Human Services. So you can Google the DHS office locations, and you put in the zip code, and it gives you all the offices. Go to one of those and apply. 42 to 64. You don't, they're not gonna, you just take your papers there with you and see what they ask, or call for an appointment and find out what they're gonna need. And then if you're 65 and over, they're gonna consider those pretty much immediately, more so than the 42 to 64. There's gonna be a little more evaluation on the 42 to 64, rather than the senior one, the 65 and over. But it would be a Department of Health and Human Services, DHS, or a Medicaid office. Okay?
Just to follow up the question, automatically those over 42 can get this Medicaid facilities.
It's not going to be automatic. They still have to go through the process and be, reviewed to find out if they're going to be able to get it.
So what if somebody over 42 happen to be sick and need to be?
That's a great question. And I worked in hospitals all my life, and I think I had talked to you about this. When somebody goes to the hospital and doesn't have insurance, don't think that there's nothing there, because there's a lot of options. If you end up in the emergency room and you end up in surgery, something big, what they do is they call social service at the hospital, and they will come and ask you about your insurance, and you say, I don't have any, and you can tell them that you're undocumented. And what they do is they'll apply for Medicaid for just that state. Okay, if you can get that, most likely that'll happen. You'll get that paid off 100%. If it's not a big amount of money, like it's just a doctor's ER visit, then they may not do that. What they'll do is you can go to the billing department and ask for a charity application. And according to your income, they will evaluate how much they will discount. So it could be 25%, 50%, 80%, or 100% of your bill will be forgiven, basically. And so that's the other option. Okay. And if it's a smaller amount, you could definitely talk to billing and put yourself on a payment plan, and they'll help you with that. Okay.
By payment plan, do you mean that they can having a scheme how to pay back all the bills?
Yeah. So if you, let's say you have $1,000 bill, and the hospital I worked at, they didn't give you how much you needed to pay. They said, how much do you want to pay? And people would say $20 a month, $50 a month, or $100 a month, whatever you wanted to do. Some will take that amount divided by 12 months and say, this is how much you have to pay every month. It just depends on the hospital. But you can do a payment plan with them.
Okay, Astrid, are you satisfied with the answer, or do you have any more question?
A few questions from friends who don't have the ID. How do they do that? Like, how do they determine the income of that person if they don't have the ID tax number yet?
I know that you can go to a tax advisor and they can do that application for you. Mm-hmm.
They don't, can they? You said something about writing their income down?
Yeah, if they don't have that, if they're keeping that track of how much they make every day that they work, they have that notebook, they can show that as income for IRS, and IRS will accept that.
Is the report provided by the employer or the person itself, like themselves?
If it's that you're undocumented, you're keeping track on your own. It's a notebook that you're just writing it in. But if you're working in a company and they're giving you checks and they're paying you with a check, then there's a record there, and they have to be giving you taking taxes out. So that means that they have an ITIN number. But if they don't have an ITIN number, it's going to be, they have to write it down. Okay.
So Joyce, if I'm undocumented and I want to show that I work and make money, I had to make that myself. So I get a piece of paper and I say, like, Tuesday I made $50, or Wednesday I made $100. 8 hours. I wait 8 hours, and then you add it up, and so for the week I made, I'll just say $400. So that's proof of my income.
But it's every month.
Every month you do that, so you write it yourself.
Can we do it like right now? Like the undocumented people can start register now? Or?
Yeah, you can. You don't need to have income. You don't need to give any information that you're even undocumented when you go on the marketplace. But remember, you won't get the tax credits.
Yeah.
You're going to be looking at the full price. So remember the sample I showed you of the one person, $643? Take away the $23. Well, we're going to add that $23. You're going to pay the whole amount. And like the family of four was $435. The one that made little. Well, that plan was like over $1,000. So you would have to pay the whole $1,000 a month for the plan if you did not have the income, documentation. Yeah.
And many of our undocumented friends are single.
Mm-hmm.
How do they make the report, or how the adjustment is made for the insurance?
Well, remember, the keeping track of the income is not for you. It's for the spouse that is documented. Remember that. Yeah, you won't be eligible. You won't be able to get tax credits. Yeah. That's only for your spouse that is documented, for the mixed family. Remember, I was talking about mixed family. So you can use that ledger for the wife that doesn't work and needs insurance, but she is a citizen.
What was the one about if you're over 42?
That's Medicaid. Over 42 to 64, you can apply for Medicaid. For undocumented, no questions asked. Yeah.
So if you're 42,
42 to 64.
and you're undocumented, you can get Medicaid insurance.
If you're undocumented, yes, you may get Medicaid insurance after you've gone through the process, and they'll tell you. Mm-hmm. You're welcome.
Talking about it.
Yeah.
Thank you. Yeah, so the magic number is if you're 42 years old, right?
Yeah, 42. They extended it because it was like 55, and then they changed it to 42 in July.
So if you're 42 and undocumented, you can get insurance
Through Medicaid.
through Medicaid, through the government.
Yeah. Through the Department of Health and Human Services office. So, well, you could, if you Google it online, DHS office locations, it'll come up, or Medicaid offices. Also, some hospitals will do it for you. Go to the billing department. Also, the food depository, if you call the food depository, they'll do it over the phone for you. They'll apply for you. You just call and give them the information, and they'll do it for you on the phone. The Chicago Food Depository will do it over the phone for you.
We should probably, maybe we can, while we're eating, we can maybe pull that out. I'll let them share.
Yeah.
They've been asking.
Any more questions, Pak Dani?
Oh,
Bahasa Indonesia boleh, Pak?
yeah, yesterday I just go to the hospital in Chicago, and then they give me like what this called? They call me to make what for Medicare, right? Yeah, and then I already got the not yet. I'm still in process.
That's good.
It's good.
Yes, that's the insurance for the government.
Oh,
So that's great.
so do I need another insurance? Or?
Yes, I'll talk to you later.
So how much for?
Well, I'll talk to you later.
Thank you very much.
You're welcome.
Any more questions from the audience?
Pada resmi semua.
Whether you are immigrants or not, or citizens.
Sometimes when we go to the marketplace, I've been to that one time. A lot of people call me. I headache because oh, you need this insurance, that insurance, like that,
Right.
So I don't want to go to marketplace because of that.
Yes.
Because so many people call you because you're gonna put in the application your name, your phone number, your everything. You gotta put it there, right? So they keep calling you, and then I said I got it already. They keep calling again.
Yeah.
They keep
Yeah,
calling again.
and the way around that is if you know that all you want is Blue Cross, you can go onto the Blue Cross website, the bcbsil.com, and view your plans there. You'll only see Blue Cross plans and pick from there. So that makes it a little easier, or whichever insurance company you chose, right? Or you're going to get the PowerPoint. So on the PowerPoint, you have my information or my team's information, and we can definitely help you with that. Okay? And guide you through it and the process and that. So however you're more comfortable with.
Okay. Thank you.
You're welcome. Yes, the prices are all the same. And the prices are like, we say on the marketplace and off the marketplace. On the marketplace means you're getting the tax credits, off means you're not. But it's the same price, it's just if you get tax credits, it's cheaper because you're getting discounts.
If they go to the BlueCross BlueShield site for tax credits, they will, right?
Yeah, the tax credits will be applied. Yeah, we have our system. I can go into the website and then go into the marketplace, pull the tax credit, and then process the plan. So yeah, we have that with the marketplace. Any other questions? Any questions online?
Any question online? The government will prepare this slide of this presentation.
Can I have application right now or online? don't like?
You could, for you, what you're looking for, it's a little different. It's very different, a whole nother beast, so I have to go over there with you.
But the good news is you have insurance.
Not yet.
Oh, not, oh, it's on the way.
They just send me for the human resource, right? They send me the letter and then I have to wait a couple weeks to get the card.
You can get the card in a week, online. Yeah, if you go into Medicare, and you can actually view your card and print it after a week. It should be in there. I've been able to do that to write, because you have to have your Medicare A and B first before you can purchase another plan to help you with it. Okay.
But the hospital, right, make for me
Um,
because I didn't buy it, but the hospital make it for me.
oh, you might be talking Medicaid, not Medicare. Medicaid, the hospital, that's what I said before. Even hospitals can apply for the Medicaid for you. So you just go to the billing department and ask them, do you do applications for Medicaid? If they say yes, you can do it at the hospital. That's probably what it is, because they don't do Medicare at the hospitals. Yeah. That's Social Security. Yeah. Yeah.
Different, right?
But I'll always help you. Whatever questions, I'll be here. So, and I don't know if you want to invite me back to have like an enrollment day that people can come and ask questions about what they're looking for and actually see the plans, and we can help guide you like that.
Yeah, I think that would be a good idea. So let us see is the response from the community here, the citizen here. So of course there are a lot of demands on it. So we can, if you may, then we can.
We'll talk about
arrange,
that. Yeah, definitely.
In this session with you. I have a question actually, Joyce. Because you were talking about the individual and group insurance, yeah. So for this citizen, if they would like to, because perhaps they are under 42, but they are working in the same company, say like that. They've been here like perhaps 2 to 5 years. If they would like to have it as a group, or their employee would like to organize to arrange insurance, health insurance for them, is that possible?
Here's the thing. If the company is bigger than 50 people, 50 employees or more, they have to provide affordable health care to their employees. So they would not be able to get tax credits on the marketplace because they're in a big company that's supposed to be giving them affordable health care. The Affordable Care Act says if it's more than 50 employees, then the company has to provide health insurance, and it's what they mean by affordable is 9.5% of your income or less. So some people think it's expensive, and it could be because it's right there on the edge of 9.5, and some will do 6% or so. It depends on the company. But you won't get tax credits if your company offers insurance. Okay. But if the company does not, then you have the option of buying on the marketplace, or some companies will give you like $100 a month to help you with the plan. You go in the marketplace, and the marketplace will take that into consideration and still give you tax credits if you can get them. Yeah, if you're documented and the application processes the right way, you can get more help from the government and your $100 from the company. Some companies do that. Instead of buying insurance for the employees, they'll just give you $100 and say go on the marketplace.
Is that enforced by law here in Illinois?
Yeah.
Every company that has over than 50 employees should provide, at least give support to their employee to have health insurance.
They don't have to give support, but if they want to, they can. The company.
If you're over 50, you have to
Over 50, they have to provide, yeah. Yeah. Over 50, they have to.
employees.
Mhm.
So if the employees, like, so if they're over 50 employees in the company, then they have to provide insurance. Suppose they had like 2 employees.
Then they don't have to provide it. The company doesn't have to provide it. They can give you some money if they want to help you out, and then you go and purchase on the marketplace.
So the number is under 50.
Mhm.
So if you're under 50, they don't have to provide insurance. And so that's where you can go on the internet, the marketplace, and get it on your own. But I think the issue there is if you're not a citizen, you're not going to get the help from the government, right? So you have to pay the full cost. Unless you're 42, right? Unless you're 42 in
Unless
Illinois.
you're 42, then you apply for
Medicaid.
Mhm.
Yeah, unless you're 42, then you can get Medicaid.
May get Medicaid.
You're 24. Oh, okay, you're too young.
Okay, thank you. Any more questions from the audience? Before we conclude, can we check the social media or from the chat room? There's no. Okay. So I think before I officially close our webinar, let me sum up for what we have discussed during this afternoon. So insurance is very essential. It became even more important during the pandemic era. There are government-funded care. If you earn more, you pay more. This is very a basic principle, actually. Yeah? So if you earn less, of course, you pay less. So it's kind of a fair way of doing of subsidizing in this insurance health. So ways to get healthcare. First, you can go to private clinics, government funded, and hospital, or to free clinics funded by NGO. If you could provide us with this list, perhaps it would be very useful to be shared with our friends here. You can scout the insurance provider on the marketplace, so you can get what you truly need, budget-wise, and types of the plans through the site. Again, remember the site, www.healthcare.gov. If you are in the federal poverty level, or VPL, you can get subsidized by the government for your insurance and could be eligible for the government Medicaid card. The enrollment is open until January 15. This is for the Medicaid, yeah? Or for the...
For Affordable Care Act, marketplace.
Okay.
Healthcare.gov.
Okay. From the healthcare.gov. Annual enrollment period is October 15 to December 7. Undocumented can also apply for Medicaid, and if you are between 42 to 64 years.
Mm-hmm.
And it will not affect your immigration status.
Correct.
If you're applying for residency. Over 65 are eligible for Medicaid for immigrant seniors.
Right.
Those are information that you need to take notes and give your attention to. Of course, everybody doesn't want to be sick or even get burdened for being sick.
Mm-hmm.
So I think this is information that is very important. Once again, on behalf of the Consulate General and our friends here, we would like to thank you very much for our resource persons today for their very useful information. So please give a round of applause to our resource person.
Thank you.
But of course, we can continue our discussion if there's any hidden question over the SOTO mini.
There is another thing I wanted to mention is Medicaid, you can apply anytime. There's no Medicaid. No, anytime,
42.
Yeah, there's no enrollment period is what I'm saying. Okay, so you can enroll every month, anytime. Okay?
Okay, thank you. By this, we will end our formal session because we will continue with our informal session. So once again, thank you very much for our participants who are following this webinar through Zoom meeting or our social media. I hope that the information that we gather today through this webinar will be very useful to you. So we will meet again because after this we will have a plan to have another webinar with different topics. So I hope that you can join us in our next webinar. So thank you very much, and have a very good evening to us. Thank you very much. But please stay here because we'll have